Hello and welcome. My name is Dustin Allen, one of the training officers at Iredell County EMS. Today we are going to learn the appropriate way to effectively reconstitute, withdraw, and administer the medication called Solu-Medrol. First of all, before we get anything started, I need you to do the most important thing, like and subscribe to the video. Next, we're going to get our PPE on, make sure our scene is safe. Alright, everything's looking good. Solu-Medrol that we carry contains 125 milligrams of medication. As you can see, we have our 3 cc syringe because we're going to be drawing up 2 cc's of fluid, so you want to have a little extra room for air. Also, you don't want to accidentally pull the plunger out of the bottom of your syringe. We have our blunt tip safety filter needle to prevent any debris from the depression of this plunger into the medication. We also have our 23 gauge IM needle in the event that we need to administer this medication intramuscularly. First things first, make sure your medication is in date, which this is. Grab it as so. We're going to depress the orange top. As you can see, it moves. There's reconstitution fluid, the provided diluent in the top, separating the medication with this little pink orange-esque plunger here, depending on if you're colorblind or not. Simply depress, the pressure will force the plunger down, provided diluent will get into the medication. Once there, we're going to gently massage the medication between our hands in a rolling motion as so. We do not want to shake the medication because vigorous agitation can basically damage the medication and it causes foaming, and foaming is bad. Alright, once we've done that, I'm going to look to see if we have any particles that have not dissolved completely. One of the causes for incomplete dissolvement of the medication is if the temperature is too cold. Recommended range for this is 66 to 77 degrees for which is considered room temperature. If it's not dissolving because it's too cold, keep it in between your hands, rub it a little bit more, or go to your backup Solu-Medrol if that one's a little bit warmer. Alright, the next step is we have a protective cap on the top. Let me ask you, have you ever had trouble trying to get into the medication like this with your blunt safety tip needle? That's because there's a little protective top on here which is going to expose our medication plunger. Pull that off, as you can see. Take our alcohol prep pad, which has been pre-opened. Aseptic technique, clean that off, let that dry. Attach your blunt filled filter needle here, again to prevent any debris that we may draw up from the deterioration of our plunger. Drawn up 2 cc's of medication, so we're going to pull about 2.5 cc's up. Move your cap, needle exposed, everybody watch out. Very gently place this in the middle, depress, there we go. Inject your air. Pull the needle down to the medication withdrawal window, which is like a little void in the top of that rubber seal. Alright, there we go. 2 cc's of medication. To prevent any needle sticks or injury, we're just going to leave that right in there and deposit that into a sharp shuttle which is located conveniently off screen. Alright, next we're going to administer it intramuscularly. We have our 1-inch 23 gauge needle which we can attach to the top. Our aseptic technique again with a clean alcohol prep pad to the deltoid region, either arm of your patient, or if we're going to go intravenously, ensure you have a patent line as so. Aseptic technique here, let it dry, apply, pinch your line, administer the medication. Let it flow. Good to go. Thank you for your time. Hope you enjoyed the video. Again, don't forget to like and subscribe. See you next time.